Forum 50. Today we're discussing the topic of emergency medical services in Sonoma County. And right now I'd like to go to Rick Navrad and ask what are the different levels of care in Sonoma County for the pre-hospital care?
In the past 3 years, the paramedic program in the county has grown tremendously. We started with providing paramedic services just in the greater Santa Rosa area in 1978, and since then the program has spread now to Rohnert Park, Sebastopol, Sonoma, Petaluma, and most recently we also spread to the Healdsburg area using emergency medical technicians too. The Guerneville area, because of its unique nature as a tourist area, uses a combination of paramedics and EMT2s. We have limited areas left, Bodega Bay, Cloverdale, and the Sea Ranch area, which are still limited to the basic life support level on their ambulance, what we call EMC1, but we do provide backup services, advanced life support, using both the ground ambulances and the sheriff's helicopter, which is a paramedic provider.
Okay, thank you. The term paramedic seems to have become a household word in the last few years, but I still don't think very many people really know what a paramedic is and what they do. Ken, maybe because you are a paramedic, you can sort of spread some light on the subject and maybe clear up any misconceptions that people may have.
Certainly. Rick has mentioned 3 separate levels of care here. The basic level, which is an EMT1A, which is the minimum training standard for any individual who works on an ambulance in the state of California. These individuals go through approximately 120 hours of training at a local community college and are prepared to go out and provide basic life support, which is splinting, oxygen administration, assessment, splinting, and are essentially capable of operating an ambulance. The second level that we have, which is unique to California, is an EMT2, Emergency Medical Technician Level 2. These individuals receive approximately 200 to 300 hours of enrichment training above the EMT1 level, allowing them to initiate certain forms of advanced life support, intravenous therapy, cardiac defibrillation, monitoring of the electrocardiograms, and the administration of limited drug list. The paramedic that the word that has become quite popular is actually the Emergency Medical Technician paramedic level. These individuals receive approximately 1,000 to 1,200 hours of training at various training institutions throughout the state and are capable of administering full advanced life support, intravenous therapy, defibrillation, use of certain life-saving surgical techniques, using an extensive list of medications to correct life-threatening problems. They also have much more in-depth training in assessment and diagnosis.
It's definitely not the scoop and run that it used to be several years ago. I know often people wonder why the paramedics or the ambulance spend so much time on the scene when actually they just want to ride to the hospital. It sounds like the paramedic has a lot to do in stabilizing that patient before they go to the hospital.
What advanced life support, through the use of paramedics and EMT2s, we bring the services that previously were only available in the hospital to the patient at the site of the accident or to their home or wherever an illness or injury has occurred. And because those services are provided much sooner and much closer to the onset of the incident, many more lives can be saved, and not just lives themselves, but what we call morbidity, or the action that a paramedic or an EMT2 takes can oftentimes make the difference in somebody spending a week in the hospital or 4 weeks in the hospital. The important thing to mention, though, is that all these individuals, despite no matter what their training level, work under a degree of medical control. They are not independent practitioners. We work under the control of a base station hospital, under the guidance of specially trained nurses and physicians who are linked to us via portable radios that are carried in the units.
Something else I'd like to ask. I think most people, when they think of the term paramedic, they think of firemen. Is that true here in Sonoma County? Are firemen paramedics, or how does that work?
Well, the only paramedic firefighters that we have in this community are those individuals employed by the public ambulance services, Chief O'Shea's department and the Petaluma Fire Department, who actually work on an ambulance. Generally, the firefighters in this community who are not on an ambulance are trained at the basic life support level, either EMT1 or first aid, and their primary responsibility is providing basic life support. Generally, the only agencies and the only vehicles carrying paramedics or EMT2s will be ambulances in this community.
It's important to note that it is almost a certainty that to receive paramedic or advanced level care, it will be an ambulance on scene.
Okay. Does a patient have a choice of which hospital they get transported to once the the paramedic is at the scene and it's time to take to the hospital, where do they go? Does the patient have a choice in that, Rick?
Yes, they most certainly do. We have what we call our point of entry plan, which is the policy that establishes what patient goes to what hospital under what circumstances. We used to always think that patients went to the closest hospital, then it was figured that we would go to the closest appropriate hospital, and now we have 5 pages just to define the word appropriate. Patient choice, though, heads the list, that if the patient is able to express a choice for which hospital they would like to go to, they will be taken there. If they're not able to express it, but their family has a choice, they'll then go to the family's choice. If their private physician has a preference, that would then be honored. It's only when they're unable to express a choice, they have no family around with a choice, and no physician preference, that we would then take them to the closest hospital. Now, one caveat on that, certain clinical conditions require the services of a particular hospital, and if someone is unconscious, we will take them to that particular hospital.
Okay. On the same token, do patients have a choice of which ambulance service? I know that in an emergency they don't look through the phone book and sort of shop around for the cheapest ambulance. How does that work?
In Sonoma County, the status and the location of all ambulances are tracked by our county EMS dispatch center, which is located in the sheriff's office. All calls received by any ambulance, public or private, are turned over to the countywide dispatch, which determines which ambulance is closest, and that is the ambulance that is sent. We won't have an ambulance running with lights and sirens right by an ambulance that would be closer to the scene. We send the closest.
Okay, good. I'd like to take another break right now, if we could. When we come back, we'll take a look at some issues that have come up from you, the public, such as regarding ambulance rates and so forth. So please stay with us. We'll be right back.